recent years, RU46 and medical abortions have been really pushed on women. What do you think about RU46?
The short answer to that question is I can't understand why any woman would want to have a medical abortion, and I'll explain why. No matter how abortion-minded she is, there are a lot of problems with RU46. First off, a medical abortion is very distinctly different from a surgical abortion. In a medical abortion, the lady takes pills, takes her RU46 medication, and then follows it up with a second medication, typically one called Cytotec, 24 to 48 hours later. It has a significant percentage of side effects associated with it. That combination is well known to cause cramping, hemorrhaging, nausea, vomiting, and a lot of extremely unpleasant symptoms. The really interesting thing about it, though, is RU46 is FDA approved up to 7 weeks from last period. It is commonly used off-label to 9 weeks. Okay. But even at 7 weeks of gestation, the failure rate was 5% at 7 weeks. As gestation gets further along, the failure rate increases. At 8 weeks, the failure rate is, 8%. At 9 weeks, the failure rate is 10%. Imagine. I mean, you're going to go through the trouble of having this abortion. You're going to go through a significant percentage of patients will go through a lot of very unpleasant symptoms, and the abortion won't even work. And then you end up with a surgical suction D&C abortion that you could have had in the first place.
And are there other health problems or along the way as well, as far
Very
as
definitely.
Having a failure rate?
There's one huge difference between a surgical and a medical abortion. When you do a surgical abortion, you have tissue, you have baby parts, you have all the contents of the uterus. And if the doctor is doing what the doctor is supposed to do, sends off that tissue to be looked at by a pathologist, who will then confirm whether or not there is pregnancy tissue, products of conception, in that specimen. You do a D&C abortion, you get back a pathology report that says there are products of conception present, you're good. You've done the procedure, you've done it correctly. In a medical abortion, there is no tissue to be examined. That woman essentially pays that money and goes through this procedure to have, basically, to have an induced miscarriage, which can happen at home, in her car, or anywhere else. But there is no tissue to be examined. The key there then becomes when a surgical abortion is done and no products of conception is seen, it means either the doctor missed the pregnancy entirely, which can happen, not very often, but it can, or more frequently, she has a tubular ectopic pregnancy, and that can be fatal.
Can you explain more the danger for a woman who may have an ectopic pregnancy if she's seeking an RU46 abortion?
You must rule out an ectopic pregnancy. But the only way to rule out an ectopic pregnancy, if you're going to use RU46, is to do an ultrasound. And not everyone prescribing RU46 is getting ultrasounds. There have been deaths associated with RU46, mostly from infections or undiagnosed ectopic pregnancy. Ectopic pregnancy can kill you in no time flat because a pregnancy was never meant to be in a fallopian tube. And it can only go so far before that tube ruptures, and hemorrhage, sometimes severe hemorrhage, follows.
Another reason, or justification, pro-abortion advocates use for abortion on demand in America is that it's necessary because of ectopic pregnancies.
That's rubbish. Ectopic pregnancies are life-threatening. Treating an ectopic pregnancy is not doing an abortion. It is saving that woman's life. It's that simple.